is Dr. Thomas Meads, and I've been with Hancock Physician Network for 4 years now. I enjoy golf. I find sports or athletics in general have helped me personally. They teach you competitiveness, stick-to-itiveness, composure under stress, attempting to get better at everything that you do. And golf certainly is a humbling game. You can play it at any level. It's lifelong, and so as I try to get better at that, you translate that into surgery, and you can always get better and improve things throughout your career, and that keeps me grounded. At the end of the day is knowing that you've treated your patients to the best of your ability, that they are improving in one way or another at whatever stage of the treatment they are, that you have reassured them, that you've connected on a personal level, and made them feel comfortable, hopeful, and that they really are getting better. Certainly not every case ends up that way. There's complications in surgery, and there's some treatments that are, or some diseases I should say, that are not treatable, and so you can always offer palliation. But you can always, no matter what it is, you can always do something to help somebody get better in some way. The baseline thought that goes through all that I do when I meet patients and when I treat them as a family member. And you may hear that from other doctors. I think that's very common. You'd always say, what would I do if they were my family member? How would I be treating them? And I'll tell the patients that. I'll say to them, you know, if you were my brother, my dad, my mom, this is what I would recommend, or in explaining things, and treat them that way. And I think if you do that and always respect the patients, they're people, as we are, and treat them that way, you'll do better and they'll do better. That's the whole point of being here, is to treat the patient. The patient comes first. For any patient, family member, or my own patients, you want to answer all their questions. You want to be as thorough as you can be in explaining things so that they understand to the best of their ability what is going to happen, why it's going to happen, what to expect, what are the potential outcomes, and how to be prepared for those as they arise. Just a well-informed patient with no questions has better mental attitude and understanding. And that's the most important thing for any operation, I believe, is the patient's mental outlook on what they're about to undergo. There have been other doctors who I've known that have retired, and you listen to the comments people say, and you admire and are respectful for how people comment on other people. And I've heard them, and I would like to be, at least say he made a difference. He was kind, he was thorough and good. Most of all, he respected his patients and cared for them.